The dreaded Ebola virus is back in Africa. This time, it is killing people in a remote part of the Democratic Republic of Congo, DRC. The World Health Organization, WHO, has identified the 2018 outbreak in DRC as the 9th Ebola outbreak in that country since the deadly disease was first identified there near the Ebola River in 1976. The DRC's Minister of Health, who declared the outbreak, said 21 people have so far been identified with the virus and 17 have died as at Tuesday, May 9th, 2018. The report has put many nations, including Nigeria, on red alert, prompting the Federal Executive Council to order surveillance on all points of entry to prevent the disease from getting in. Following the government's call to Nigerians to be vigilant, what measures can people take to protect themselves? These and more are the questions that we shall be looking at on the program Nigeria Today. I am Segun Ojelade. In the studio to discuss the Ebola watch and the federal government's surveillance order on the nation's entry points is Dr. Chikwe Ihekwazu. He is the Chief Executive Officer of the Nigerian Center for Disease Control, NCDC. Doctor, I welcome you to the program.
Thank you, Shago. It's great to be on your show again.
Yeah. The program is Nigeria Today. We're looking at the topic we call Ebola Watch as a result of the fake directive to the Federal Ministry of Health and all agencies concerned with entry and exit in the country. Now, Doctor, is the time ripe now to be a little scared of Ebola in Nigeria?
I don't think the right thing is to be scared. I think the outbreak in 2014-15 really caught us by surprise because it was the first time we're seeing the outbreak of Ebola virus disease in West Africa. But actually in East Central Africa, where this specific outbreak is happening, they've actually had a series of Ebola outbreaks in the past. They've become very good in managing the outbreak, in detecting and responding. So I think there's no cause for alarm. Within Nigeria, what has really happened over the past few years, since 2015, is that we have built our institutions to be able to prepare. We know what to do. We have developed our institution, our capabilities in different aspects of the response, what needs to be done. So in fact, I think we're much better prepared than we've ever been. We're not where we would like to be yet, but I don't think there's any cause for alarm for Nigerians right now.
Okay, we're going to pursue some of the things that you've said, but let's continue with the DRC situation.
Outbreak, yes.
What do we know about it? To the extent that the FEC has directed that there is need for us to be careful.
Yes, I think the government of Nigeria has done the right thing in asking us to raise our level of preparedness. But you know, this is our job. We're almost always working 24/7, analyzing various threats around the world and making sure that we're able to respond should we have any cause to. In this specific case, we got the news a couple of days ago from WHO that there were these cases, and 2 had been confirmed. There are actually 2 confirmed cases. The rest are linked and they're most likely to be related. There's a series of steps that we always have to take when that happens. But there are several aspects that lead to a large outbreak. In a contained outbreak, in what we know at the moment, it's a fairly well-defined group of people. They all have had some form of contact to each other So at the moment, there's really no cause for alarm that it's spreading. However, it's early days. What WHO has done is send a team to that village and to the country to try and establish. The first thing we always do is to establish the size of the outbreak. We try and find all the cases and all their contacts, make sure that we understand how big it is so that we can define the response. And that's one thing we've learned from the West African outbreak a couple of years ago, is that early work is critical in controlling the outbreak. Once it gets out over a specific critical point, it becomes a lot more difficult to control, especially when it gets into an urban city. But once it's in a village where there's not a lot of travel in and out, it's much easier to manage. So all the efforts at the moment, as we speak, is really in making sure that we identify everyone in that chain of transmission and make sure they're under surveillance, and we break the chain of transmission of this virus.
Well, we call this program Ebola Watch, surveillance. Yeah. You know, now if we're to watch now, what are we going to be watching? Are we watching DRC to ensure that another soya does not slip into this country? How are we ensuring that?
I think there are two things. Firstly, we as government, the Nigeria Center for Disease Control, and our colleagues in the port health services, those are the colleagues that are at the airports and at the points of entry, really pay very careful attention to anyone coming in. There are thermal screeners at most airports. But you know, we're a complex country. We're lucky the last time the individual came in through the airport in Lagos. We have a lot of land borders that are very challenging. So the other thing, if someone does come in and does have those signs, that we can take a blood sample, and we know we have a lab now that is able to make that diagnosis. So that's the responsibility of government in terms of watching. However, I think what this reminds us of again is, you know, all those messages that were so predominant during the Ebola outbreak, about what we should be doing ourselves, about hand hygiene, about doctors wearing gloves, and all those things that we have forgotten.
All have died.
Yes. So this is a reminder again for all of us, because we often say, what is government doing? But we all have a responsibility ourselves as citizens to do the bit that we need to do.
Let me come in there. One of the things I've put down from what you have said is that we have built institutions. You understand? Have we learned anything? You go to the airport now, nobody is putting that small gun to your eye to see whether you have a fever or anything. The schools are devoid of those hand washing stuff. If you now get to offices, any office around here, but you go to see that box, but you can be sure there is no disinfectant in them. I mean, what have we learned?
Well, it's a question we'll ask ourselves. You know, I think at the airport, we don't have the guns, but there's a screen there. It can identify you if you have a high temperature, so we don't need the things pointing at you. But like I was saying, the responsibility to protect ourselves is not just for the doctors and the people at the airport. Really is all of us. You know, we have to really get this into our daily routine. At least the hand washing in schools and hospitals and in public places. So there's a lot of change that needs to happen. It's just that sometimes when we change in Nigeria, we think it's a temporary process. But this is a change of attitude, and it is up to all of us. If you go and see your doctor and he's not wearing his gloves to examine you, you as a patient have a responsibility to tell him, sir, you know, you should be wearing gloves. And these are things that we need to have the confidence to do in Nigeria, because they could save our lives or yours.
You know, those are the things that we can see. The handguns, the wash hand basins and the rest of it. Those are the things that we can see. I mean, we can see. But there are things that we can't see that probably are in place. For instance, training now, emergency response, or even when there is an occurrence, an outbreak, do we have sufficient reaction time? What have we built with the healthcare providers? Do we have the institutions? Where do we go when there is an outbreak? Do we have the facilities now?
So when I said we're building the institutions, that was exactly what we were referring to. Just a month, 6 weeks ago, we had a big yellow fever simulation exercise in Lagos. Actually simulated a live outbreak coming in through the borders, including not just the health service responders, but all the other response agencies in Lagos, and went fairly well. At the moment, we've just come back from the southwest. We're going around the country training healthcare workers, mostly focused on Lassa, but the risks and protection measures needed for Lassa are very similar to that of Ebola. So we're going around the country in all the zones, training healthcare workers in terms of what to do to protect themselves. We have instituted in Nigeria a sample transportation mechanism. So if you collect a sample from a patient that you think it's Lassa or Ebola, you can get that sample to one of 4 reference labs in Nigeria within 24 hours without needing yourself to carry it there. So there are lots of small things that you don't see them because it's not a bridge, it's not a highway, but there are a lot of institutional changes that are happening in our public health architecture that will protect the lives of Nigerians.
I'm curious, how are people like you, your institution, and other stakeholders, how are you responding to this fake directive? When the Federal Executive Council says hype up surveillance at borders and the rest of, what has happened since this directive came?
So what we have done, which we were in the process of doing already, but we're grateful that our government also insisted that we do this, is set up an emergency operations center. So we have a center in our headquarters where we use to respond to different outbreaks. What we have done is now reactivate it for Ebola, make sure that our teams, so we have teams of clinicians, we call them first responders. So if there's a case, that first team that will go and examine the patient, take a sample, because not every healthcare worker is trained to do this.
Yes.
It requires a certain level of expertise. So we have a group of clinicians, we'll bring them together again and practice what we do so that we know that we are prepared to move when we need to. But that's one aspect. The other aspect is developing our treatment and isolation centers. And we have asked every state government in Nigeria to have one identified treatment and isolation center to manage highly infectious patients with potentially highly infectious diseases. We're not there yet, but that's really the challenge that we have. Every state must have one center identified and ready to, and with the confidence and competence to manage these cases.
Okay, Doctor, before we started this program, we went out earlier in the day to find out what do Nigerians know about Ebola, or what have we learned from the experiences of 2014 and 2015. We'll take a short break, and then we'll take those excerpts.
Sir, are you aware that Ebola is in Africa? Before now, were you aware?
Yes, I'm aware.
Yes, I'm aware Ebola is back in Africa.
Yes, I'm aware.
I just heard it today.
When Ebola was in Liberia and it got to Nigeria, and there are a lot of measures that was put in place as at that time, and most of those measures were not working anymore. Most time, if you go out, you go to public places, you go to bank, you see there's hand sanitizer at the entrance of the bank. If you go there now, most of these things are not working.
The Nigerian thing is, when the problem comes, everybody start running here and there. No preventive measure. So what I would advise basically is that from now, we should go back to that time when we are all prepared. And we all know that there's Ebola in Nigeria, and we are all putting all the measures to make sure we don't have the Ebola.
I believe that one of the causes of Ebola is a result of unhealthy environment. I believe that government should encourage its citizens or enlighten them or educate them measures on how to keep the environment clean so that all these kind of diseases will not, erupt.
Our government is supposed to do is to put adequate measures in place in order to checkmate it. That is that. Our doctors, all of them have to be alert, understand? And we, the citizens, we have to be alert also.
Nigerians out there, Doctor, you've heard all the things they said, but there is one very key thing about stepping up campaign, enlightenment. Is it not time that we begin to increase awareness of people on Ebola and other opportunistic diseases?
You're absolutely right. We are going to do this. We have been really pushing not just on Ebola but on several other diseases all the time. I've been in your studio severally, and we try and really have a very aggressive risk communications agenda. But I really like the comment of the last lady that spoke about citizens and what we need to do. You see, with infectious diseases, it's not, government can't do everything. We all have a role to play. Ebola is one extreme of the situation, but the very simple things for vaccine preventable diseases, we need to actually take our children to get vaccinated. Vaccines are free in any primary health care center in Nigeria, yet people are not taking their children there. You know, you have to keep let your children sleep under a bed net to prevent malaria. So there are many things that we as citizens can do as well, which is what we're pushing. The last point about cleanliness is very critical, especially for diseases like Lassa. If we keep our homes filthy, we invite in the rats, and then transmission can happen. Yes, government has a big role to play, and at least from the point of view of the Nigeria Center for Disease Control, we take that responsibility very seriously. But really, citizens also have a role to play in all of these diseases.
Earlier, before we went on that short break, you said something about engagement with states.
Yes.
But what frightens me is that you said we are not there yet. After the experiences of 2014 and 2015 states, there are still some states that are yet to establish an identified center for Ebola. What is actually happening?
Yes, so there's it's a process. You know, it's a big country, so it takes a while to cover the entire country. But more than ever before, during the last Lassa fever outbreak, I was on this show praising the governor of Ondo State and Ebonyi State in terms of how proactive they have been in supporting the responses in the state. Right now in Imo, they're building a treatment center, brand new, supported to an extent by the federal government, but the state is also doing. So there's a lot of effort happening, but we haven't covered the 36+1 states in Nigeria, and really that's where we need to get to, so that even if you don't have a perfect center, you have a 10-12 bed facility within a tertiary hospital with a few doctors and nurses that are confident to manage these cases when they do happen.
Now, is it time now to start running away from those delicious bush meats and embracing a monkey, or what are the other things that you will, because those period 2004, those are the messages that were in the air. So what must we avoid now?
So like we said with the bushmeat, it's never really in the eating of well-cooked bushmeat. The risk is always in the preparation. It's in touching them, especially body fluids from these animals, that poses the most risk. So the people at most risk are those catching, killing, and preparing. And that's where they really have to take precautions. If possible, wear gloves. If not, really wash your hands aggressively afterwards. And for those of us buying, when we buy, please cook and fry properly, and then you can enjoy your meat as much as you like.
Any other thing that we should avoid?
Yes, the rest are really the very boring but important universal precautions. You know, it's not interesting to tell people to wash their hands, but it's amazing how much that protects you from infectious diseases. It's not easy to tell you, you know, we get tired of doing these things. We have normalized seeing refuse in towns and villages. You know, we as a community must stand up. If there's a refuse on our street, don't wait for federal government to come to Adekiti to pack your refuse. You know, you can do something yourself. So we really need to mobilize to ensure that we keep our communities free from infectious diseases.
Is it time that the hand sanitizers and the testing, is it time we bring them back now?
So my key message is wash your hands with soap and water.
Okay.
Hand sanitizers are actually a secondary component, you know, in the event that you don't have soap and water. But if you have soap and water, it's the perfect solution.
Are we at risk?
We're always at risk. Infectious diseases are around us, but the key thing is preparedness. Are we ready to respond? And I think our level of preparedness is higher than it's ever been.
Okay, when in 2014, 2015, when we had that outbreak, like somebody said, we were all running helter-skelter, but thank God we knew what to do. We did the right thing. And then all of us, we started praising ourselves. And it was one of the major things that we achieved during that period. God forbid it happens. If it does, are we still going to be able to respond with the same swiftness and accuracy?
We would respond even better, because what happened at that time, the Nigeria Center for Disease Control was really in its infancy. It was a new organization, very few staff. But what the federal government has really done is enable this agency grow, enable us grow. The bill giving us a mandate has just passed through Senate. Senate gave it an accelerated hearing. So I think for once we can really be proud that the government has invested in the Nigeria Center for Disease Control in a project that doesn't get a lot of attention, but really has developed our capacity to protect ourselves and protect the country.
Well, many Nigerians would like to know whether there is a cure for Ebola. Is there?
So what has happened since that outbreak in 2014-15 is a new vaccine. That vaccine cannot be given to everyone, but it's one of the options that we now have on the table for this outbreak that we did not have 2 years ago. So there's a planning process going on. It will be evaluated whether to be used, and if that decision is made to use it, we have a new tool in our arsenal that we didn't have 3 years ago.
How much do we know about this disease in terms of, because we know that it comes with so many things, fever, bleeding, you know. How much information is available to us so that, well, we never can tell. Another Thomas Sawyer can slip in through anywhere. So, but if you now see certain symptoms, what are those symptoms that should alert every one of us?
Yeah, I think the one good and bad thing about Ebola is that we still don't fully understand the reservoir of the virus. We know it's an animal, we know it's either a bat or
monkey,
or one of them. We don't know for sure. Why it's important for us, that level of uncertainty makes us to be even more prepared, because no one expected it to happen in Guinea. We thought this was limited to Eastern Central Africa. So we know that it can happen in Nigeria again, not even with someone coming in, because we don't really understand how it came in through the animal world. So we have to keep our preparedness levels very high. I think the key sign, like we all know, is when you have bleeding from any of your orifices. But I think the critical thing, the message that we have been sharing is, if you have a fever, do get tested for malaria. There is a simple test available, so that if it's not malaria, we can look for the other possible causes. And it could be Lassa, it could be anything else. But if we're not looking and people are just medicating themselves all over the place without testing, we're putting all of us at risk.
Because we don't have time left. One very sad thing is that when diseases like this do break out, medical personnel, the fatality among them is always very huge. We had one in 2015. How are we sure that today our medical personnel have enough capacity to protect themselves quickly?
So this has really been at the heart of our messaging. When you're a doctor or a nurse, you are trained to want to help, and it is in that helping that you put yourself at risk. So what we've been very simple measures. Please don't jump in without wearing gloves. Protect yourself. We need you to be alive to treat others.
Lastly, one or two words. Give Nigerians assurance that all is well.
So I would say we're better prepared than we've ever been, but we cannot do this alone. We need everybody on board. Nigerians, doctors, nurses, everybody needs to be on board. And together we can protect this great country.
Yeah, Doctor, I'm being told that I've overstayed my welcome on this program today. So I must thank you, Dr. Chikwe Ihekwazu, the Chief Executive Officer of Nigerian Center for Disease Control. I thank you for coming.
Thank you, Shegun. Thanks a lot.
Thank you very much. Well, this is where we call it a date on the program Nigeria Today. We shall be back tomorrow for the last edition this week. On behalf of my producer, Julieta Aino, do join us tomorrow. Bye-bye.